Hei, salutare și bine ați venit sau revenit pe canalul meu de YouTube. În videoul anterior am vorbit despre faptul că locuiesc în Londra cu încă 7 oameni, iar una dintre colegele noastre este suspectă de coronavirus. Lucrând în domeniul medical, ca medic rezident, ea a fost trimisă săptămâna trecută să se autoizoleze pentru 7 zile, pentru că în UK medicii nu erau testați. Martina se simte mai bine acum, a scăpat de febră și a fost sunată de către colegii ei de la muncă și de către superiori, așa că a început să lucreze din nou la spital. Acum problema este că au început să crească foarte mult cazurile în UK. Sunt peste 40.000 de cazuri în Anglia acum. În ultimele zile s-au înregistrat mai mult de 4.000 de cazuri pe zi. Problema e că, pe de o parte, e nevoie de medici în spitale pentru că au crescut foarte mult cazurile și atunci cei care sunt suspecți de coronavirus după o săptămână sunt chemați la muncă, dar pe de altă parte este riscant pentru că ei oricând pot să predea mai departe virusul altor pacienți sau colegilor lor. Din acest punct de vedere și cumva din această nemulțumire a faptului că medicii nu erau testați, un medic rezident a creat o petiție online prin care se cerea testarea prioritară a cadrelor medicale. Această petiție a fost semnată de aproape 1,5 milion de oameni, iar de curând au apărut știri și informații cum că de acum încolo spitalele vor trebui să organizeze laboratoarele în așa fel încât medicii să fie testați. Pentru că mulți dintre voi mi-ați scris să vă țin la curent cu starea de sănătate a colegei mele, am decis să o sun pe Skype la ea în cameră și să vedem și cum se simte, dar și care e atmosfera în spital acum, având în vedere că situația s-a înrăutățit atât de mult și în Anglia. Hi Martina! How are
Hi,
you?
Olenka. How are you?
How are you feeling? Olenka is Alexandra in Polish. Just to know. How are you? How are you feeling?
I'm actually good. I'm very positive. I'm back at work now and ready and firing, that power.
How do you feel? Like, how is your recovering?
So the first day back, I work on the 8th floor, and I always try to walk up the stairs. The first day back was very difficult because I had to stop on every floor. I was quite short of breath. I did have a bit of dizziness during the ward round on the first day back. But I mean, that slowly started to resolve, and I feel much better now. And it's almost like back to normal. However, I do get occasional breathlessness periods. So I hope I'm now immune, and they call it a superhuman now, apparently.
How is the situation in the hospital now?
So I feel we're about to approach a huge storm of patients with the infection, considering we had a lockdown, so everything was closed for about 2 weeks now. And it exactly takes about 2 weeks for the initial symptoms to develop. We're getting towards the peak of patients coming in. And we have patients across different ages. So it's not just easy to say, oh, because you're an elderly, you'll come to the hospital because you have comorbidities. We actually have young patients as well. And those young patients are in ITU, so intensive care unit. ICU, intensive care unit. And those people are on ventilators. And our ICU is actually saturated to 80 to 90% already with people. So we are waiting new ventilators now. But I mean, we don't know when they're going to come. So it's quite uncertain. We're very short-staffed in terms of nurses, as they obviously have a more direct contact with patients than we do, and healthcare assistants as well, because they have to dress the patients, they have to clean the patients, etc. So they've probably been even more exposed than some of the doctors. And we do see a lot more people wearing masks and patients with patients interactions. And most of our ward are actually COVID positive patients now.
Are you wearing mask or any other equipment during work?
So, because in my ward so far, people who are tested positive are in isolation rooms, so-called side rooms. And if they are suspected, so they're in a side room, so they're in different bays. But in general, if people are suspected to have COVID, we just wear a basic surgical masks. And if I could just grab one for you, I actually brought some from work. So that's a basic surgical mask. It looks like this. It's got a bit of an adjustment for your nose, so you could have a seal, like a better tighter seal, and then you just wrap it around your head. Then you wear gloves and a kind of little apron that it's like a shape of an apron that you would wear in the kitchen, but it's plastic. And we also have scrubs at work that we change daily. And for the bigger masks, for patients who are confirmed COVID, they're actually FFP masks 3, which have a nicer filter and a tighter seal. There's actually some protection, but I feel like we should probably be escalating it to a bit better things. But we're very short of it. The whole world is short of it. So we just have to be very careful how we use it. So it's very upsetting because people are going to die. And I mean, we were already seeing people dying. We're already seeing patients who are coming into hospital already dying. And it's very sad because it's a viral infection. And with viral infections, our treatment is best supportive care. So we do treat with antibiotics. We do cover for extra co-infections with bacteria, which commonly coexist with viral infections. However, I mean, it's just as best as we can. So if you're short of breath and you're desaturating, that means your oxygen level in the blood drops. Then we would put you on oxygen, and maximum we could put you on is 15 liters. So if you can't maintain your saturation above 95%-ish, then that's quite bad. And we've had patients who are saturating on 80%, and they're going down and down with 15 liters, and there's nothing we could do. So it's very frustrating seeing that, knowing that those patients have a lot of comorbidities. So if we were to put them on a ventilator for a time being until the infection resolves and then excubate them, they would not survive.
From now on, the NHS staff should be tested. Have you started testing medical professionals?
So that is true. That we in my hospital, I know they started testing the ICU workers, so patients who are in intensive care unit, and I know nursing staff and doctors are being tested there. They're trying to develop the antibody testing to make sure that people are fit and ready to go back to work, and so-called the superhumans with the immunity now. So hopefully that will get developed a bit sooner, because the problem is we're so short of those things. I mean, we have to be, again, very, very careful who we test, because we can't just throw tests randomly, because there will be not enough people to actually perform those tests. Our policies, our guidelines change daily. We get updates daily. We get education webinars after work, as well as we can't really meet in bigger groups with doctors or nurses as teams. We now have everything online, just like you and I are talking now. We have those kind of webinars because that's what the life is like currently.
Yeah, that's true. Thank you so much. I'm really glad that you feels better now. I'm waiting to spend time with you in the house, hopefully soon.
Yeah, I can't wait to like. It's been a very stressful time, but yeah, I can't wait.
Vă mulțumesc tuturor celor care mi-ați trimis mesaje și mi-ați urat gânduri bune, atât pentru mine cât și pentru Martina. Eu deocamdată mă simt bine, tușesc, dar este doar o tusă. Nu am avut febră până acum, deși mi-au temperatura zilnic. Vă voi ține oricum la curent cu starea de sănătate, atât a mea cât și a celorlalți din casă. Vă mulțumesc de asemenea că ați urmărit și acest video. Dați subscribe, share și lăsați-mi comentarii să știu și eu cum vă simțiți voi în perioada aceasta. Și abia aștept să ne revedem. Vă îmbrățișez pe toți și stați safe!